Did you have confidence this would happen? I mean, I'm so thrilled. I wasn't sure what would happen. I just knew it was all we could do for 20 years ago.
He was very positive. I think I was very optimistic. But then because it was taking longer than what I had thought it
Oh, I
would.
see.
So while there was still hope, but I would kind of go up and down a little bit. I wasn't,
You would get frustrated.
Yeah,
Yeah.
it took a while.
it
And-
took 3 years,
Yeah,
for us
and
to
I was
have her.
I was encouraging you.
Yes.
I tell you, when you've had bone marrow transplants, there's been some irradiation of your uterus, and some impact. So I think that at first we were worried that there'd be no implantation because of uterine side effects. But actually, we found that if we wait long enough, they get pregnant. I mean, despite the fact that it's a lower implantation rate because of the uterine receptivity, you do implant because you got a very young ovary, the eggs are fantastic, and eventually you have an embryo that does really implant, and you have a baby. That's what we've discovered. You're typical, really.
That's the first time I've ever had that.
Yeah, first time you've been called typical, right? Yeah, right. Yeah, so I was really confident sooner, you went through a lot. I was confident sooner or later you get pregnant because that's what we're finding out. We're finding out over 75% of women that are cancer survivors that have had ovary tissue frozen and transplanted back, over 75% get pregnant, and we only had one miscarriage, and so it's a very low miscarriage rate, but the live baby rate is fantastic. We have one cancer survivor that has 4 babies from her transplanted ovary tissue already. 4. And one has 3, actually. One leukemia patient has 3. And you're among the very first leukemia patients that have babies from ovary transplant. It really works. But you're a lesson that Dr. Pincus was right. You're an oncologist. If you must take the ovary out and freeze it when the patient, after her chemo, the patient's in remission, but the ovary hasn't been destroyed. I mean, the developing follicles have, but the resting follicles have not all been destroyed, and that's when you take it out because there's no cancer cells then.
Yeah, we got very
And
lucky.
then 20 years later, you transplant it back.
Yeah, that's all.
Yeah, let's let her say something. Let's let Madeline say something.
Are you ready?
Because she's kind of whited out on the screen. I want people to be able to see her really,
Yeah.
really well. She's a little bit whited out on the screen.
With the little
Oh, look at
strawberry.
her. She is really fantastic for she's a 3-week-old, and
Yeah.
look at how alert she is. Wow. Could be she's even more alert because she had those 2 months in NICU, and so she experienced the outside world earlier than most kids do.
Yeah.
And she's incredibly alert, really, really, totally healthy.
She's a
That's
very
exciting.
happy baby. So
Happy baby.
usually smiles, except right now we're just taking it all in.
Yeah. Well, I'll tell you, that early smile, I saw her smile. That early smile is really important for development because that early smile attracts the attention of everyone. And so that interaction with people, because she's smiling, look at her smile, that interaction with people really is a good quality vicious cycle, in that she develops intense awareness because people are communicating with her. That early smile is really important for childhood development.
So yeah, she smiles. She doesn't laugh yet, but
We'll
not
get
yet.